So panel C, New York Cannabis Growers and Processors Association, Alan Gandelman, New York Medical Cannabis Industry Association, Ms. Betty, I'm sorry, you'll have to pronounce your first name for me. I didn't want to mess it up. And Sam Action Inc., Kevin Sabat. And if we can go in that order, that would be great.
Okay. Hello, my name is Alan Gandelman, and I'm the president of Head and Heel, a New York organic vegetable farm, hemp grower, and processor. I'm also the president of the New York State Cannabis Growers and Processors Association. The NYC GPA represents New York businesses that produce high-quality hemp and cannabis products. We deeply appreciate the possibilities offered in the MRTA. New York will need to balance issues involving taxes, licensing, and speed to market. The MRTA does an excellent job allowing for social consumption, cannabis home grow, micro businesses, home delivery, and funding for social equity applicants. These policies should be, without question, integrated into any final legislation enacted by the state. Our tax analysis of the MRTA and the CRTA shows that the CRTA has potential to harm smaller businesses. We have seen repeatedly that fixed rates in a mature market benefit large companies that can operate at a smaller profit margin. The effective tax rate in the CRTA, depending on the product, is between 30 and 50%. This will drive consumers to the illicit market or across state lines. Massachusetts is more competitive currently with a 20% rate. The MRTA provides a better alternative with a percent-based tax on real market values. The 18% tax it creates will help develop a competitive landscape where smaller businesses can thrive. For distribution, having a required distributor layer in the supply chain will have negative unintended consequences that will harm small entrepreneurs. Forcing cultivators or manufacturers to go through large distributors and getting their products to market will squeeze profits from small producers and prevent retailers from dealing directly with the source. In terms of licensing, from cultivation through dispensaries, that should take top priority. New York will need at least 5 million square feet of cultivation capacity. We have an opportunity to have hundreds of farmers create enough supply to address the existing market, which will need 2,000 dispensaries across the state. This estimate is modest. For comparison, New York currently has 3,300 liquor stores and a lot more than that when you consider places selling beer. Speed to licensing is also extremely important. We have seen several states struggling with getting their licenses into the hands of small businesses, while states like Arizona stood up their adult use market within 3 months by leveraging existing infrastructure. New York has a key advantage that other states did not: existing hemp farmers and processors ready to start in the adult use industry from day one. Amongst us, we have a current capacity to meet the needs of New York by January 1st, 2022, and provide supply to all New York retailers. To address these issues, we suggest legislatively mandated deadlines, putting a time frame on licensing for all classes. As we have seen in both the medical marijuana and the hemp programs, the slow rollout of regulations negatively impacted both patients and businesses. For reference, after a year and $1 billion in sales, Illinois still does not have one Black-owned cannabis dispensary. We cannot allow this kind of regulatory oversight to happen here. We believe a legislative mandate on these issues will avoid problems that other states have experienced, especially related to small businesses and social equity applicants.
Next, the Medical Cannabis Industry Association. And can you just pronounce your first name for me so I'll know for the next time?
It's Nigist, rhymes with biggest, so that's Nigist Abebi. So good afternoon, everyone. I am the Director of Public Policy at Columbia Care, a New York headquartered and licensed medical cannabis operator. I also serve as the president of the New York Medical Cannabis Industry Association, which represents 8 of the state's medical cannabis registered organizations, or ROs. We aim to protect and serve medical cannabis patients and help establish a safe, well-regulated, and equitable adult use program. The association enthusiastically supports efforts to regulate cannabis for adult use. And in particular, in New York, we have the opportunity to set the gold standard, which is why it's so important that we get this right. We think that the medical operators already invested in New York facilities, jobs, and serving New York patients can help support the social equity and economic goals underpinning these legislative efforts. We do feel that there's a sense of urgency given neighboring states' progress towards legalization and the potential for federal normalization on the horizon. And as the adult use proposals currently stand, The MRTA has critical elements that the association supports, including comprehensive social equity policies and key improvements to the medical program, such as adding whole flower, which I outlined in more detail in my written testimony. Specific to today's focus on revenue, I would like to emphasize that the RFP auction process included in the CRTA will primarily serve to significantly delay revenue and job growth, while also undermining social equity principles. Among current standards for cannabis legalization policy, the RFP process in the CRTA uniquely fails on a few fronts. It delays tax revenue and job growth. In particular, when it comes to including the ROs, New York has already run a competitive process to determine that the current ROs are able to cultivate, process, and sell medical cannabis and abide by regulations, which we've done for years now. The time-consuming RFP process delays any ability to initiate adult use sales and start investing in new jobs and new infrastructure. The process also would delay social equity, allowing the existing processors to be assessed a license fee for the privilege of remaining operational in the adult use program could seed the state administered social equity fund immediately, which is a concept included in the MRTA. And lastly, the process would leave patients in the lurch. Without adult use co-location, medical operators will not be able to survive in an adult use market. Pediatric patients, any folks in hospice or other institutional care settings will not be able to access, much less afford, medicine in the adult use program. The revenue focus, we believe, should be on bringing medical ROs and social equity licensees to market as quickly as possible to focus on generating the tax revenue, the job creation, and meeting equity goals simultaneously. Our industry supports nearly 1,000 jobs and has made considerable investments to serve New York patients, and we want to continue to serve New Yorkers by helping New York get adult use right. I look forward to entertaining any questions and appreciate your time and consideration this evening.
Next, Sam, action.
Thank you, Madam Chair. My testimony tonight is based on my own experience and that of over a dozen top scientists who serve on the advisory board for SAM, Smart Approaches to Marijuana, which I co-founded with former U.S. Congressman Patrick Kennedy. We're the leading nonpartisan, nonprofit national organization based in New York now, offering a science-based approach to marijuana policy. I recently served in the Obama administration as a senior drug policy advisor, and I'm an adjunct professor at Yale University. While we should remove criminal penalties and continue to do that by not penalizing people for use, while we absolutely should expunge records and invest in prevention and treatment, generally the legalization of marijuana is bad policy and should be opposed. Scientific literature on the harms of marijuana use exists in abundance. I'm not going over that from my testimony tonight, but if you're interested in that, the most latest review was by the Independent National Academies of Sciences, which reviewed over 20,000 peer-reviewed research articles linking both marijuana, but also the legalization of marijuana to severe negative outcomes. There are really three big issues here specifically relevant to the Budget Committee that I want to bring up. First is outcomes like hospital admissions due to high potency THC ingestion or increased poison center calls should absolutely be expected, especially in the beginning of legalization. This has happened in every single state that's legalized without exception. These would incur real costs in New York at a time when our hospital capacity is at the brink at a time of a major pandemic. It doesn't make sense to stretch those resources even more. The second point is, for states that have legalized, revenue for marijuana sales often accounts for really less than about 1% of their overall budget. Colorado marijuana revenue, for example, represents 0.9% of the state budget. California is much worse. There's a thriving black market that does not go away when you legalize the drug. And there are costs as well. So it's not just revenue. Of course, we have to count the costs. A study in Connecticut, for example, found that the costs associated if they were to legalize marijuana, and it's definitely not a sure thing that they will this year, would total more than $200 million, while revenue would be around $100 million. Legalization would result in a variety of also unquantifiable costs as well. And while our neighbors over in New Jersey may start to rake in a few bucks in a couple of years, they will also have several costs that we must take into account. The third point is really, I agree with the first person testifying that we should look at that Illinois example. It's really the only other state other than a Vermont and a modified version that's legalized marijuana through the legislature. They said they'd be the standard for social equity, and yet they have not one major minority license holder. Everything is going to wealthy investors. Big tobacco is now a major investor, also big alcohol, and there's absolutely nothing to hold them back. They are already lobbying for legalization, Altria, Philip Morris, that is, in Virginia, as well as in DC on Capitol Hill. And we know who will be making profits if legalization passes here in New York.
One sec. We do have a few members. If we go with Assemblyman Ra.
Thank you. I was wondering if the panelists could just weigh in on something for me. Obviously, we're considering this particular proposal. There were just some changes proposed in the 30-day amendments with regard to distribution of revenues, which I assume was meant to get the governor's proposal closer to the proposal we've seen in the legislature. And, you know, there's a lot of talk of equity funds and things like that. But, you know, the last panelists just mentioned, you know, one such cost, you know, with poison control and things like that. But what your thoughts might be on there being some set aside of revenues to deal with costs like that, to deal with potential public safety costs, you know, like training of drug recognition experts, things of that nature, which is expensive. And last week we had or 2 weeks ago, we had a hearing with local governments. And I mean, the number of trained drug recognition experts amongst the largest police departments in our state, I mean, it's close, a handful. So there's going to be a huge need there, and it's going to be expensive.
Well, there's going to be a huge need, Assemblyman, and there will never be enough. I mean, DREs, there can never be enough drug recognition expert officers to be able, and I'm sure everyone's familiar with the term, to be able to identify drug to drivers. Marijuana affects everybody differently in terms of their driving ability and their system, although scientific research now says it about doubles your risk of a car crash. We know that the unfortunate limo crash a few years ago, the driver was positive for marijuana. We know several of the Amtrak issues were related to marijuana. So I do think it's a big issue. A drug driving fatality costs about $1 million in lost social costs. And I think we can't underestimate also the administrative costs, the regulatory costs as well. I haven't seen one state deal with that particularly well in terms of being able to distribute that. It usually goes to a general fund. There are often promises that it will go to prevention and treatment and things like that. But again, I haven't seen that well. I've certainly not seen it be reinvested, as we're hearing in communities that have been hurt by the war on drugs. Frankly, the communities we work with that are a lot of very vulnerable communities, the last thing they want are pot shops in their community, just like they don't want liquor stores in their community. It doesn't help them. It doesn't raise, you know, it doesn't help their youth. It doesn't help raise real estate prices. And they see it as just like those payday cash shops. And I'm sure most of you know, the majority of localities in states that have legalized have actually banned marijuana sales altogether, and they don't want the revenue because they know it comes with considerable costs. So there are a lot of considerations there.
I think if you look at the MRTA, there is a portion of local sales tax revenue that does go to the local municipalities. So if they want to spend it on enforcement, et cetera, they could. But I do think we need to realize that these are already issues communities are dealing with. All of a sudden, because we're going to have an adult use program, does not mean the rates of use are going to skyrocket. That is just simply not true and not what we have seen in other states. I think the bigger issue is that we still have a social equity piece happening in the city. So for Mr. SABET to say that, oh, these communities, they don't want this, they don't want that, I think, you know, that's really not fair. And I think we should be letting those communities speak for themselves when it comes to this topic. And I don't think making those sweeping generalizations is really fair to anyone. That being said, the amount of jobs and revenue this will create in those communities, especially if we allow social consumption and home delivery, is astronomical. The last revenue report that came out, there was an independent study that came out last week that was citing 50,000 jobs. I mean, this is not a small number of jobs, especially affecting communities that have been impacted by the war on drugs.
I
do want to, I just want to interject here.
The
the legislature bill addresses some of this revenue commitments as well.
Okay, we are going to go to the Senate. Lucy, you're muted.
Thank you. So I think everybody knows I am the lead sponsor in the Senate of the bill being debated. And it's not the intention of this hearing to per se be a MRTA hearing. I appreciate Kevin's continued advocacy against the bill. He's been a consistent, I'm starting to think voice of one to continually tell me this is all wrong. And I'm happy to discuss it with whomever, but I don't think you actually want me to tonight. So I'm not going to, other than to urge people to take a look at the actual bill, take a look at the comparisons between the proposal the Assembly and the Senate have. It's the same as bill in both houses, MRTA, and take a look at what's going on around the country. But I certainly don't think you will see large numbers of communities pulling out of the program once it's started. And I do just want to remind everyone, all the concerns that they may have about marijuana, and it's legitimate, concerns about any kind of mind-altering drug, whether it's alcohol or marijuana or a dangerous addictive drug, that there are prices that come along with it. I completely agree. The thing is, here in New York, that's already been here forever. We're the largest marijuana market in the country by far. It's just none of it is legal or regulated with any attempts to make sure that it's safe product or that there's a limitation on the strength of the THC or that you're going after people who are violating your law. So my position is we already have it. Should we be doing it right? And people can welcome having different positions.
Senator,
yes.
If I commend you actually, even though we are on opposite sides of this issue, clearly, I do commend you for being honest and forthright about the dangers and the costs and saying publicly, even though it may not be in the interest of the bill necessarily, but saying publicly that this isn't going to solve budget issues, and it's going to take some time, and we have to be sort of, honest and direct about it. I think the reason why, and I'm flattered that you think it's just me, but joined by, the Medical Society of the State of New York, which is firmly behind our efforts, as well as the New York State PTA, and many other groups, by the way, law enforcement groups, public safety, public health, parent groups who are joining in opposition to just the general effort, either effort to legalize marijuana, is that what we're concerned about is not so much taking the legal market and just saying, okay, if let's say 10% of New Yorkers, use marijuana, we're going to just shift that over to the legal market, and then it'll just be an easy shift. What our concern is going to be, and I have to take issue with Alan's point. There was just a study yesterday about California youth use increasing after legalization. The issue is, and it's not just youth, it's other ages too, that we're going to add to it. It's not that we all think that it's going to go away or we don't have a, like you said, a robust marijuana market now. We do. I'd personally rather have, 7% of New Yorkers, engaged in a marijuana market that might be illegal than 30%, engaged in something that's controlled by big tobacco and big alcohol. That is a trade-off. All policy is trade-offs, and someone could disagree with that. But the worry is not so much that there'll be like a one-to-one shift. The worry is that we're going to see costs mount and there be a dual market, actually a triple market, a illegal market remaining, a legal market, and then a gray market. And the gray market we've seen, for example, in places like Colorado, big time, where you have, people and distributors buying legally, selling illegally because it's still illegal for kids and, after hours and that kind of thing. So I think those are the concerns, especially when we start talking about delivery services, on-site consumption, pot bars generally. These are some of the, concerns.
So I think we agree on one thing, is that we don't want to see an industry controlled by large tobacco companies. And that's exactly what my testimony is about. You are on point 1000% there. We want to see a small, decentralized, local system benefiting small business owners, small entrepreneurs, benefiting the people that have been harmed by the war on drugs. That's exactly what we would like to see. And that's exactly what we're talking about here.
Yeah.
I want to echo the point that it does not have to be inevitable who owns, and there's a lot of avenue here for the state to be determining who is participating in the future cannabis market. And while some people might be comfortable with 7% of New Yorkers being exposed to policing risks and other side effects of the war on drugs, I think others would like to start to see a regulated market and revenue being generated to address those very same policing costs.
If we
and
think
other
we're not going to have
line
police
items that
intervention,
happen.
All right, my
we
time
think we're
is
not
up, actually, guys. The clock just went off, so I'm going to hand it back to the assembly. Do you have anyone else, Aline?
Yes, we do. We have Assemblyman Cahill.
Thank you. I'd like to, excuse me for doing this, but I'd like to bring it back to the budget. And there is a proposal in the budget by the governor for legalization. And if I am not misunderstanding the conversation that I just heard, I think we have a panel of 3 people who are opposed to the governor's proposal. Is that a fair, just with a nod of the heads, is that a fair consensus?
I think we believe the governor's proposal could be improved as well. And that between the CRTA and the MRTA, there's a pathway to effective legalization in New York.
Okay, and the second question that I had is the MRTA bill provides for a significant amount of the resources that would be derived from the bill to be specifically dedicated to purposes other than puffing up the budget, and pardon that pun there. But it's intended to enhance programs for prevention and treatment. It's intended for reinvesting in communities. It's intended for a variety of purposes that do not tout marijuana as a revenue producer and therefore make it as attractive to the state of New York as the lottery has become. Let's not even talk about alcohol for a minute, but lottery has become, as I call it, a tax on stupidity. And it seems like we could be heading down the same path if marijuana becomes primarily a revenue raiser. What other measures do you think we could take to assure that if we have a marijuana market that is legal in New York State, that ends the horrible impact that it's had on a number of communities because it is illegal? What could we do to assure that it is the most responsible market in the United States of America?
Well, there are a lot of things that could be done. And I think, we're not trying to be unproductive here and just be kind of, no. Although we don't like it, we stand with every major medical association in the country in opposing legalization. However, I think even Senator Krueger mentioned the idea of potency limits. There's no reason why you need to sell 99.9% shatter, which has, we're just beginning to learn what even the short-term impacts of that are, let alone medium to long-term. We can look at child packaging, warning labels. It makes no sense to me if we're banning flavored vapes and all kinds of things on e-cigarette, and when many of those same companies are in the marijuana business and are absolutely going to try and get in here, that we wouldn't do the same thing for marijuana. So we can look to those examples. We can look to the no smoking law, a Clean Indoor Air Act kind of example. So there are things that can be done. The fundamental disagreement is that I don't think that revenue that we're talking about is going to even come close, budget aside, is going to even come close to needing to provide for the prevention, treatment. Again, where we're putting our vulnerable healthcare resources, given the current pandemic, the driving issue, and these other things that are going to happen. I absolutely want to reduce police presence when it comes to marijuana. We're on the same page there. But I personally, when I look at Colorado and see an increase in youth, Black and Hispanic youth being arrested in Colorado after legalization because of, it's still illegal for under 21. It's still illegal public use. It's still illegal on, in public transit, although lately in Manhattan, it sort of doesn't seem that way, but it's supposed to be. And those things could be enforced. And we could actually see in many ways an uptake in enforcement among certain populations, like we've seen in Colorado. So I think we have to be very careful in thinking.
If I may interrupt you, I want to allow the other panelists to speak, and I'm well over my time.
Oh,
if you don't
yeah,
mind.
I didn't notice.
So in terms of safety, if you look what we've done with the hemp CBD extracts bill, there is very strict full panel testing for all pesticides, chemicals, etc. There's very clear labeling instructions. There is a whole seed to sale tracking system in place, third-party inspections to make sure that we're not putting out products, or the cannabis industry is not putting out products that are dangerous or harmful like the illegal industry could be doing onto the marketplace. And so I think that, that is really the biggest thing and the biggest advantage we have about the legal marketplace is the full transparency and testing and labeling that we can provide.
And the good news is that's already in place in New York with the medical program. There are already very strong regulations around testing standards, advertising, processes already established for reviewing products and reviewing advertisements and even speaking engagements. And a number of those protections are already in place and would just need to be expanded and applied to the adult use market.
Thanks very much.
Thank you. We'll go to the Senate now.
Okay, I think I saw Tom O'Mara's hand up first.
Thank you, Liz. Thank you, all three of you, for your perspectives on this. I'm just wondering, as I sit here in the discussion about marijuana and looking back to Governor Cuomo's change in attitude on this a couple of years ago, where I believe throughout his entire career, according to him, marijuana was a gateway drug.
Yeah.
And then he turned to his health commissioner to look at this costs, benefits of marijuana recreationally. And in the course of, I think it was about 2 months or less, his health commissioner, Howard Zucker, came back with a cost-benefit analysis saying that now the benefits of marijuana outweigh its costs and ill effects on society. I'm wondering if any of you have reviewed Dr. Zucker's analysis and what your thoughts are now on what actually are the benefits of this other than prospectively a couple $100 million.
Yeah, so we've
I'd
actually
be happy to speak to some of that. First of all, I think, again, the medical cannabis program is here, which is a sign that the state believes that cannabis does have benefit for some consumers. The average medical cannabis patient in New York is a 55-year-old woman and she's sick. That's actually not too far off from what the average cannabis consumer looks like in an adult use market. According to Albert Einstein Montefiore's research in Colorado, roughly 2/3 of all adult use customers are coming in for a health or wellness reason. And the top 3 reasons are insomnia, anxiety, and chronic pain. And so I think that, like a lot of folks over the course of even of the last few decades, as we have seen
my
more
question,
research,
Nagise, my
we've seen
question
more
is not
evidence.
about the medical aspects of it.
Yeah.
It's about the recreational aspects of it. I was one of the first Republicans to sign on to the medical marijuana legislation and support its use for
We
medicinal
appreciate that.
purposes. It's the recreational side of it that concerns me, and how
so
the health commissioner
So-
reviewed this in a matter of 2 months, determining that there were now all of a sudden more benefits of it than there were societal costs of it.
So, Senator, we actually did a review of Mr. Zucker's specific report that you're talking about. We did a line-by-line review, and when I say we, I'm talking major, researchers, NIH researchers, nonpartisan folks that some of them don't have an opinion on legalization, but they were really struck. I got to be honest with you. And again, as somebody who worked in Obama's drug strategy, I have respect for the governor and I have a respect for Mr. Zucker, but we were really taken aback, if I'm to be honest here, at the tone and the things that were emphasized in that report. And I wish I could say it was in a good way. We were taken aback, but it was not in a good way. And there were many questionable claims that looked really straight out of talking points from the industry. And I think the political timing was interesting. I think that we have to look at all of that, but I'm happy to share in the chat with panelists and attendees the rebuttal, which was from about 2 years back right now, that goes through that. So I'll yield the time, but you can see that.
That'd be great. Thank you.
Sure.
Okay, Tom's done. Assembly, anyone else?
No, we do not.
All right, then I'm going to turn to Senator Alexis WEIK. Did I pronounce your last name correctly? I didn't, did I?
Yes, you did. WEIK is correct.
Oh.
Thank you.
Thank you.
So thank you to all of our panelists. I appreciate your input. And I just, Kevin, I'd like to tell you, you're not the voice of one, you're the voice of many. As I've talked to many communities, I've not yet heard of a community that supports the legalization of recreational marijuana. especially in a time when we're looking at the effects of smokers and what it's having on COVID. I don't think we're looking to legalize something that people are now going to be inhaling, damaging their lungs and making them, another candidate for COVID and overwhelming our hospitals. So this is probably not a good time, especially when we are fighting to get rid of opioids, and this is something we've spent billions of dollars on, and now we're going to try to make them legal, and that's supposed to help us in our fight. As Senator Krueger has mentioned, this is a mind-altering drug, and New York is one of the largest markets already. What on earth makes us think that creating a law is going to actually eliminate the black market and actually create revenue? Does anyone think this is actually going to create revenue, especially when we're looking at other states that have already proven that this is not creating a revenue? There's a short-term influx of revenue, and then the black market takes over again. So what are we looking at? Why are we making this legal, and what revenue can we expect?
I would disagree with you strongly that the black market takes over again. I mean, if you look at the more mature markets like Colorado, like Oregon, most of their sales have actually moved to the legal market, not the black market. So I think that's just an incorrect assumption. And then, yes, smoking anything and cannabis can be a public health issue, same to your point, but the fact still remains that New York is the biggest cannabis market in the country, as Senator Krueger has just mentioned. So to not get this under control, to not have products that are regulated, to not tax them and pay for the public health damage that could already be occurring just does not make any sense. I completely disagree that black market will thrive here. If taxing is done right, if licensing is done right, if we give the right entrepreneurs the access to the market in their own communities, the black market could be gone in a matter of years.
One thing I love about living in New York and being a New Yorker is that, we usually do things better than anyone else, and we know it, and we do. We follow through with that promise. And I think that hubris may get us into a little bit of trouble this time, because every state before this has said these exact things. We will fund these communities. We will get rid of the black market. We will have robust regulation and testing so we know what's in it. And when you look at, for example, again, don't take our word for it. Look at independent reports. I mean, I clearly have a point of view, but look at independent reports like the Oregon Secretary of State report that came out last year, 2019, which found that basically 3% of the entire state legal market was being regulated properly. The vast majority of sales were happening on the gray or black markets. And it wasn't fulfilling the promises that it said. And so, again, look at Ontario, Canada. I mean, we're a state that neighbors, our neighbor to the north. Look at the Auditor General of Ontario, Canada province, which just did a report saying that 80% of their market is still on the black market. And these are, eminently sensible Canadians, and with regulations that frankly don't have the influence of big tobacco and alcohol, like unfortunately many of our US states do. And they are freely saying, sort of quietly saying, but they are saying this is a problem. So I urge you all to do that independent research.
I'm very confused. You're telling us big tobacco and big alcohol is going to come in and take over the entire industry, but the black market's going to be completely flourishing.
Absolutely.
Is true, wouldn't those huge industries want to completely abolish the black market and steal all
right, folks, this isn't an opportunity for you to debate each other. It's for members to ask questions. And I believe that we have no other members looking to ask questions.
I just need to close with one statement. I'm sorry, Helene.
Sure.
Just to clarify for Senator WEIK, when she referenced marijuana as if it was an opioid, it's not an opioid. There's no research showing that it leads to addiction like opioids. And in fact, the places in the world and this country that have easier access to marijuana have lower levels of opioid abuse and overdoses and death. So you might not like marijuana and you might not want legal marijuana. That's totally your right. But please don't confuse what cannabis is and what opioids are, because they're not.
Well, Senator, please know that I'm not confusing them, but no doubt it is a gateway drug and it will lead to opioids, as facts and research will show you. And it's time and time again everywhere. And if you ever had a loved one who was an addict, you'll know that it's generally a gateway drug to opioids. And since we're spending billions of dollars to fight opioids, I don't think we have the money set aside to then facilitate the rehab centers and the medical costs it's going to cost the state when we see all of the dangers that Mr. Sabet Dr. Sabet, I'm sorry, has been referencing. And I don't think the state is in the position to fund those issues at this time. Do you?
Well, I'm hoping that revenue from legal marijuana will help to fund drug treatment and prevention and education. And again,
well, no one actually answered my question. I was asking, how much revenue do we actually expect to make from the legalization of recreational marijuana?
Oh, it's projected over a longer period of time. So I can get you the data from my proposal. I won't tonight, but I can get you that. But again, the science has proved that it is not a gateway drug to opioids. And that's been,
there's
So
many
with that,
scientific
we're gonna
research
move,
that
we're gonna,
that can debate that, yeah.
okay.
we'll leave this for future debate
Right.
and thank our panelists for being here and for helping having this lively debate. And we will move on to panel D.